Hello students, welcome to EPG Pathsala. This is Dr. V. Premla Priyadarshini from the Department of Food Service Management and Dietetics of Avinash Lingam Institute for Home Science and Higher Education for Women, here with you to teach you on the topic enteral feeding. Today's presentation of mine will have a brief introduction on enteral feeding. With this brief introduction, let us now see the objectives of this module. This current module will make you to gain knowledge on enteral feeding practices and different types of enteral feeds. Understand the different types of feeding techniques and their complications. Let me start our today's lesson with a better understanding on why enteral feeding. Though nothing can match a oral feeding in the maintenance of nutritional status of a patient, tube feeding is suggested when the patient is not fit to consume food orally due to the following reasons. If there is a paralysis of muscle leading to loss of swallowing reflex in case of diphtheria, polio and Parkinson's disease, those who cannot eat due to persistent anorexia, meaning lack of appetite, hence a forced feeding is needed. Patients who are in coma or in unconscious state. Those who have malabsorption, that is lack of absorption of nutrients. Patients with short bowel syndrome. And for patients who are severely under or malnourished in case of children with protein energy malnutrition, and for those who cannot digest and absorb, or for patient who cannot feed after a surgery, or for patients suffering from neurological or renal diseases, babies with low birth weight, severe diarrhea and cancer are the causes or the need why we have to tube feed them. Before we go in for different types of feeding, let us study about the goal of tube feeding and the types of food given through tubes. A good feeding practices should aim at providing a nutritionally adequate feed to meet the metabolic demand of the body. Feeds should be well tolerated. It should be non-irritating, non-stimulating and easy to digest. The feed should be easy to prepare and should be economical might as well. Having seen on goals, let us now see the different types of food that has to be fed through the tubes. Basically, patients on tube feeding is fed with three types of foods. They are the natural liquid foods, blenderized foods, commercially supplied polymeric mixtures, or in simple word, elemental diets or a pre-digested diet. Coming to our natural foods are liquids like whole or skim milk, egg and some form of carbohydrate such as strained cooked cereals, sugars, tender coconut, etc. Vegetable oil or cream and non-fat dry milk are also incorporated to increase the calorific and the protein levels respectively. Foods like Complan, Horlicks, Nutrilite, etc. can also be added to different food to increase their nutritive value. Many convalescent patients who are often depressed and have little appetite benefit from appetizing food of high nutrient density. Now, on the other hand, a blenderized feeding is a feeding where the ordinary food items which cannot be swallowed are blended to make thin liquids which can pass through a nasogastric tube. Yes, you're right, a tube which can pass through a nose or feeding the patient through a nose. Blenderized feeding should be planned in such a way that each ml provides 1 calorie on the whole, and each feed should contribute 1500 calories and 50 grams of protein. Therefore, to achieve this, water should be added to the blenderized feed to make the volume a whole of 1500 ml. Tube feedings are prepared from the ordinary food of a normal diet by using a high-speed blender. Remember that blenderized feeding can also be prepared by using starch, milk, skim milk, powdered egg, soya flour, refined oil, salt and curd. Blenderized tube feeding are well tolerated and are less likely to be associated with diarrhea and are also less expensive when compared to commercial formulas. Commercial formulas or elemental diets are nothing but normal foods which may be replaced by a preparation of protein or amino acid, fat and carbohydrate in easily absorbable form, that is in a pre-digested form. Such preparations are known as elemental diet. For tube feeding, commercially supplied polymeric mixtures can also be used. Complan is given to supply 2000 kilocalories. The commercial preparation possesses the advantages of convenience, constant composition, minimal preparation time and ease of administration. The disadvantages are high cost, an unpleasant taste and sometimes high osmolarity. Elemental diet, though can be given orally, palatability may be a problem and tube feeding can be restored. Though elemental diets are better tolerated, the human gut is capable of absorbing complex material as well. To tell you on the feeding requirements, a concentration of about 1 kilocalorie per milliliter is satisfactory. Lesser concentration increases the volume which must be given to meet the nutrient and energy needs. Greater concentration is more likely to produce diarrhea and may be too thick to pass through the tubes. Remember that the feeding is started through a continuous drip at the rate of 50 ml per hour. The rate is increased by 20 ml every 24 hours until the required volume is achieved, usually with 100 to 120 ml per hour. The concentration or the rate of flow may have to be decreased if there is vomiting, abdominal cramp or diarrhea. Do not forget that feeding requirements are based on previous nutritional status and other feeds given to the patient. Now let us see how we have to take care of the solution, that is the feed by itself. Feeding solutions have to be treated with full hygienic precautions during the preparation, storage and as well as administration. Feeds should be stored in a refrigerator to avoid bacterial growth and taken out before administration in time to reach room temperature. Very cold food are not tolerated, and remember, do not reheat the feeds. A feed should be discarded when it has been more than 24 hours out of storage. And there are 4 different infusion techniques that one has to follow while feeding the patient through the tubes. They are the continuous method in which the feeds are passed or infused using a pump or a gravity flow. Cyclic method has an off and on period in 24 hours. Interrupted method is at a regular period of interruption in 24 hours. A bolus feeding is where a large volume of food is given in a short time. Depending on the nature and the severity of disease conditions, there are different types of tube feeding techniques. They are nasogastric feeding. Yes, you're right, feeding the patient through the nasal route. Gastrostomy, feeding a patient by inserting a tube directly into the stomach through a hole. Ostomy means a hole. And finally, jejunostomy, feeding the patient by inserting a tube directly into the jejunum is called as jejunostomy. Let us now learn about these feeding practices in detail. Nasogastric feeding is a practice of feeding the patient by passing a tube into the stomach through the nose is called as nasogastric feeding. Naso means nose, gastric means stomach. It is also called as Levian tube or simply abbreviated as NG. The nasogastric tube may also be used for removing fluids from the stomach. Generally, patients who are on nasogastric feeding is not given anything orally without the concurrence of the doctor or staff nurse. The patient on NPO meaning nothing by mouth. Now let us see some of the points to be kept in mind while feeding a patient through nasogastric route. As a dietitian, we must be alert and look for the signs and symptoms of aspiration, diarrhea, constipation and delayed stomach emptying. If the patient complains nausea, complain of discomfort or fullness, vomiting, diarrhea, distension of abdomen coughing and indigestion or heartburn, we have to immediately bring it to the notice of doctor and nurse. Also, look for the symptoms of redness, swelling, drainage, odor or pain at the tube of incision site. Also check for elevated temperature, respiratory distress, increased pulse rate and complain of flatulence. Remember that when a patient is tube fed, dry mouth, dry lips and sore throat are some of the common discomfort that they experience. Ice cubes and candies can be given to moist their lips. Check with a nurse for frequent oral hygiene and mouth rinse. The nose and nostrils should be cleaned once in every 4 to 8 hours. Let us now move on to the next feeding method, the gastrostomy. A gastrostomy is a surgical procedure in which a tube is placed directly into the stomach for the feeding. A small surgical opening is made through an abdominal wall into the stomach and the tube is inserted to hold it in its place. The tube is often used for a patient who may require tube feeding for an extended period of time and for those who cannot use their oral nasogastric route, as in case of oral cancer or cancer of esophagus. A gastrostomy is normally referred as G-tube. Now let us learn the factors to be considered while feeding a patient through gastrostomy tube. First and foremost is to keep all the feeding accessories like medicine cup, syringe, spoon and gauze in sterile conditions. Water alone should be used to dilute medicine and to flush the tube. It is better to use a piston syringe rather than an asepto syringe for maximum suction. The feed should be at room temperature, as too cold and too hot liquid can cause abdominal cramps. For practical purpose, it is always advisable to give liquid medications whenever possible to avoid obstruction. If tablets are to be given, it has to be crushed and diluted. In case of capsules, they have to be emptied into a cup, mix it well with a diluent and then give. Remember, the diluent should be used and restricted, as too much of fluids may result in overload. Ensure that the medicines are washed or flushed thoroughly into the tube. Medicines that are irritating and incompatible must be given separately by flushing an additional allowance of 15 to 30 cc of water before and after administration. Otherwise, the medicine can be crushed, mixed together and administered at the same time. Now let us see what a jejunal feeding is all about. A jejunal feeding is the one in which an artificial opening into the jejunum through the abdominal wall is made to feed the patient through a tube. It may be a permanent or a temporary opening, and it is used for both feeding or administration of medication. Usually an NG tube or a G tube or a J tube, I mean a jejunal tube, will be attached to an electronic feeding pump that controls the flow of the fluid. Most pumps have an alarm that sounds when the flow is interrupted. The dietitian must notify the nurse immediately if the alarm sounds. Similarly, when the patient is on J tube, should be observed frequently. If the pump is not working properly, the patient may receive a wrong amount of nourishment or fluid may enter too quickly, and this can cause nausea, vomiting and aspiration. The jejunal tube may become dislodged from the jejunum, or the skin may become irritated at the site of insertion. Infection can occur if aseptic practices are not carefully followed. The patient should not be made to lie flat, rather the head of the bed should be slightly elevated. We have to make regular observation and promptly report to the nurse any potential complications. Recently, commercial formulas are widely used to prevent complications. Not only that, it also ensures the intake of prescribed nutrients. Some of the do's and don'ts in J feeding are, as said earlier, raise the head of the bed to make the feeding comfortable to both the patient as well as the dietitian and to avoid complications. After the completion of the continuous feeding, shut off the pump and clamp the tube. When separating the tube from a pump, avoid contamination of open end. Remember to check the placement of the tube by auscultating the resident's abdomen about 3 inches below the sternum with a stethoscope. Gently insert 10 cc of air into the tube. You should hear the bubble entering the stomach. If you hear the sound, then gently draw back on the piston of the syringe. The appearance of gastric content implies that the tube is packed and placed in the stomach properly. If no gastric content appears, the tube may be against the lining of the stomach or the tube may be obstructed. After you establish that the tube is in its place and in correct position, clamp or connect the tube. Reattach the syringe without the piston to the end of the tube and open the clamp. Flush the tube with approximately 30 cc of water. Administer the medication. Flush it with 30 cc of water after the final medication is administered. Verify that medication cups are clear of any remnant of crushed pills or liquid medications. Do not force any medication or fluid into the tube. Allow gravity to work as possible. If necessary, gentle pressure may be applied. Take the help of a nurse if the tube is obstructed or unplugged. While delivering the medication, deliver it slowly and don't allow the fluid to flow quick. If the medication doesn't flow properly, don't force it. It may be too thick to flow through the tube, or if so, dilute it with water. Be careful not to overload the patient with too much of fluid. If you suspect that the tube placement is inhibiting the flow, stop the procedure and re-evaluate the placement of the tube. Monitor the patient's reaction throughout the procedure. If the resident exhibits signs of discomfort, stop the procedure immediately. Rinse the syringe utilized for medication, installation, and store it in a clean manner. The other key points to be considered are: be sure and check for G-tube placement prior to administering medications if required by facility policy. Flush the G-tube, I mean the gastrostomy tube, after checking for placement and before any medications are administered. Check order for amount of fluid to be used for flush. Once daily, clean the peritoneal skin with mild soap and water or solutions listed as by specific physician's order, and allow the skin to air dry for 20 minutes to avoid skin irritation. Clean the insertion site whenever spillage occurs. To prevent installation of too much of fluid, more than 400 ml of liquid at one time for an adult, plan the medication installation so that it does not go inside with the patient's bowels feeding. Withhold the medication if there is 100 ml of residual obtained and notify the nurse. Reinstill any gastric content obtained back into the tube. An excessive amount of residual may indicate intestinal obstructions. Oily medications, enteric-coated medications, or sustained release tablets are contraindicated for installation through an enteral tube. Oily medications may cling on to the sides of the tube and resist mixing with the irrigating solution. The therapeutic response of enteric-coated or sustained release medications would be altered or decreased if the medications were crushed or removed from gelatin capsules before installation through an enteral tube. Following the do's and don'ts, let us now learn on the complications of enteral feeding. Aspiration of stomach content and adverse medication reactions are potential cause of concern with enteral tube feeding. If medication is given in conjunction with a continuous enteral feeding, be alert for delayed or impaired medication absorption. Report any adverse effect promptly to the nurse. Should a patient be receiving a continuous tube feeding and you observe the patient to be coughing, complaining of fullness or discomfort, dysphoric, short of breath, or cyanotic, notify the nurse immediately, as the feeding may be stopped and evaluation conducted by the licensed nurse. To summarize, students, so far we have learned what is a tube feeding, why do we need to tube feed a patient, the different tube feeds, namely the natural, blended and the elemental feed, and different infusion techniques and the sites of tube feeding, namely the nasogastric, gastrostomy and jejunal feeding. I am sure by this time you are familiar with their merits and demerits and the do's and don'ts that we have to follow while feeding a patient through tubes. Students, always keep it in your mind that as a dietitian, it is our responsibility to provide a safe, nutritious and a hygienic food to our patient to foster a healthy living. Thank you for listening. Enrich yourself with more learning. Have a good day.